Welcome back to this week's episode of The Feds, the podcast of Feds for Freedom. I'm Stephanie Weidel. I'm excited to announce that Feds for Freedom and the Virginia Medical Freedom Alliance are teaming up to host a powerful Health Freedom Summit in 2 weeks. I invite you to join us on October 10th and 11th at Patrick Henry College in Purcellville, Virginia, where we're bringing together leading voices in medical and constitutional freedom advocacy. Experts from the medical, military, and federal sectors will share their insights to empower you to protect yourself from government overreach. The summit kicks off on Friday afternoon, October 10th, continuing into Saturday with constitutional attorneys, a bold physician, freedom advocates, an FBI whistleblower, and more. They cover critical topics like medical data surveillance, unconstitutional mandates, and the fight for sovereignty. Several of our speakers have been past podcast guests. This is a fantastic opportunity to interact one-on-one with freedom advocates who are actually in the weeds and getting the job done. We have many organizations and individuals who will be vendors at the event and have scheduled ample time for visiting their tables and networking. So don't miss your chance to engage with fellow freedom fighters. For the full speaker list and to secure your tickets, visit fedsforfreedom.org. You can also learn how to become a summit sponsor. Join us in Purcellville on October 10th and 11th for an unforgettable event. Get your tickets now at fedsforfreedom.org.
Welcome to the Feds, insiders bringing accountability, integrity, and reform to a broken bureaucracy. At Feds for Freedom, we value constructive dissent and healthy debate. The views and opinions shared in today's episode are those of the speaker alone and do not express the views or opinions of the U.S. government or any other employer.
Today, I am joined by Jodi O'Malley, an HHS nurse who blew the whistle on the underreporting of COVID vaccine injuries and showed the blatant, unethical bent within the healthcare system. As a result of her exposing the wrong to Project Veritas, multiple charges were brought against her. And after appearing before multiple boards, she cleared her name. Today, she is here to talk with me more about what she saw as the core issue that has led to the corruption within the healthcare system and has led to the retaliation against her for exposing the truth. Jodi, thank you so much for joining me today.
Yes, you as well, Stephanie. Thank you for having me.
Well, thanks so much for having me on your platform. That was a wonderful time to talk about the settlement. Thanks so much for including us in that. Well, Jodi, would you tell us a little bit about yourself and what your job was when COVID hit in 2020?
So in 2020, in January of that year, I had transferred from the pre-op PACU department and went to float pool. And so in float pool, I floated around to every area in the hospital: pain management, chemo, ICU, ER. And then when COVID struck, they asked me if I could be hospital supervisor. So I wound up working in that position about 60% of the time there, and ICU and ER.
All right. So you are a federal nurse, or were a federal nurse in HHS. Would you just explain how that works?
Yeah, so Health and Human Services, a branch underneath that is IHS, Indian Health Services, which services the Native American community. And I worked for the hospital system, Phoenix Indian Medical Center, which serves the Native Americans. So it's a clinic on site. They have clinics. They, pediatricians, ophthalmologists, you name it. But then we also have a hospital where it's an ER, med surg. We also had an OB unit, ICU.
So how long had you been in healthcare by the time 2020 happened?
So I had just graduated. I graduated in 2014. And so I had only been a nurse, 6, 7 years at that point.
Okay.
I got my license later in life when, my children were grown, and I, had always felt a calling to be a nurse. But, Back in the 90s when I was looking to go to nursing school, I was actually bartending and I was making way more money. Nurses at that time, I think they were making like $12 an hour. And so I had put it off. And then fast forward to the age of 35, I actually had a friend remind me that I always wanted to be a nurse. And, life gets to you, the struggles of life and all of that. And I said, oh, that's right. No wonder why I like watching these trauma shows and all of that. So I had changed careers several times at that point, and I said, okay, let me see if I really like this. I'm going to get my CNA certification. And I loved it. And in order to get into the hospital, because it just was so saturated, I got in through the back door going through the food and service. So I was running food trays, doing diet education with people and until they had a CNA PCT position. So that's where I started. So I really gained a lot of knowledge of the hospital from, starting in the industry.
That's fascinating. Well, many will remember the Project Veritas story in which you showed a video of hospital staff, doctors and nurses openly discussing the underreporting of COVID vaccine injury and revealing that the healthcare was rotted and put the institution before the actual health of the patient. So, what shocked you most during those 2 years, like 2021, 22, before and then after the shots were rolled out?
So in 2020, in the very beginning, try to go through this process a little bit quicker, I just was appalled at the fear. I was seeing fear 24/7 on every news screen, coming from all the news stations and, newspapers. And it was just fear, fear, fear. And I quickly realized that what I was seeing was resembled propaganda. And so I stayed alert. I chose never to fear, but to do research. And I continued to do research on Public Health Policy 101. Do we ever isolate the healthy with the sick? Do we ever stop the functioning of our society for a respiratory virus, which you cannot control? There's no vaccines that, for respiratory viruses. They happen every year. They're so small. So it was basically that started it. And then we shut down all surgeries, all diagnostic procedures. We told people to stay home, to not come into the hospital until they were blue, and they couldn't breathe. Like, that's not healthcare. That's not how we practice medicine. We never want people to be so overwhelmed in their body with inflammation before we start treating them. And really, quite frankly, in 2019, 2020 flu season, October 1st of 2019, to May, that's usually what it runs, we had a lot of people, myself included, that, came into the hospital sick. But we treated them, Stephanie. We treated them. We gave them, antibiotics to prevent a secondary infection. We gave them nebulizers. We gave them steroids. And then all of a sudden, we're telling people not to come in. So the hospitals were completely empty. Like I said, we stopped doing colonoscopies. We stopped doing cath procedures. Only if somebody was actively having a heart attack were they into the cath lab. We weren't doing angioplasties. They weren't doing any diagnostics for cancers. Everything got halted. And I just was absolutely appalled from the beginning. And I started speaking out. on Facebook and asking nurses. At that point, I had been in so many different areas of nursing. I had hundreds of people on my Facebook friends that were nurses. So I reached out to the social media and I was like, what are you guys seeing? What are you doing? It was a lot of emotional responses. Like, we don't know. We don't know enough about this, but then I had people private message me and say, I'm in New York and I'm sitting in my hotel room, making $5,000 a week, you know? So, and also my hospital is staffed with the United States Public Health Commission Corps officers. There were several of them that were deployed to that Mercy ship that was supposed to handle coronavirus patients or the overflow. And they came back and said, we saw like 9 people. And I'm like, what in the world is going on? And then not educating our children. We knew immediately that children were not affected by this, but they were making it seem like they were the vectors. And if they breathed, they were going to kill grandma. And so the mask, that was a big thorn in my side. Once I started researching that, realizing that masks are not going to stop an aerosolized virus. And so that's basically 2020 for me. And then the testing. Let's not forget about the testing. These PCR tests that were under EUA, they were experimental.
Yes.
And, if somebody tested positive and they needed to be hospitalized, even for like a gallbladder, right? They were put into isolation room. And I know with nurses, like, we don't isolate people unless we absolutely have to. And yeah, it was just a bunch of rabbit holes that I went down in 2020. And that's actually when I found out about RFK Jr. and started following him and some of the things he was saying and so many others, Dr. McCullough
Yes.
and FLCCC. And, and then with that, there were treatments and there were protocols that were being given to people. And we weren't doing any of that in the hospital, any of that. So right away, I was realizing that what was happening was completely against science, completely against standard of care, and completely against ethics.
Mm. Were the staff at your hospital bothered by all this as well? I mean, your video showed that at least one other doctor was very much on your side and understood you something was seriously wrong. So would you tell us about the reactions of the staff and especially the ones that were in the video that you brought to Project Veritas?
Yeah, so going back a little bit to answer the second half of your question, once the vaccine was rolling out, I was asking the hospital, like, are we going to do any modules on, because we always have modules every year. Are we going to do a refresher on VAERS? Are we going to ask the nurses and the doctors to start collecting the data? Because who's collecting this data? We have all of these people coming in with XYZ, but we're not associating it with the vaccine. Isn't that our role? We're supposed to help collect the data, and nobody was doing that. Everybody had their blinders on. They weren't even asking, are you vaccinated? If so, when? We had a whole list of COVID questions like, did you go to China? Were you around somebody who tested positive? Those kinds of questions. And I asked them, hey, can you add a couple of these questions so that when the nurse and the doctor gets the patient, that it will at least prompt them to ask these questions and then we can collect the data. And they had no interest in doing that.
And were they not interested because they themselves were under pressure and a mandate to get the shot themselves?
Well, yes. They had, well, at that point, we were not mandated. I think it was a test to see how many people are going to voluntarily take this shot. And in March or April of 2021, the vaccine was rolled out in December of 2020. By April, the government, they knew, hey, there's only like 15% of people that took this shot. What are we going to do? So then the talk of mandating it started happening. And then you had nurses just say, okay, and doctors, providers just say, okay, I'm just going to take it. I estimate that maybe 30-40% just took it. And then when they realized, hey, we need a lot more people to take this shot, that's when in September, October, the mandates started coming down that if you do not take it, you're going to lose your job. But I think, Stephanie, people were so fearful. They were fearful of losing their jobs. At this point, there was a lot of moral distress, that was happening in healthcare that was leading to burnout, moral injury of, no, you have to. First, we were healthcare heroes, let's not forget that. And that pumped people up to go along with these protocols that were changing overnight, thinking that they were, doing their job to save humanity, realizing that they were violating, all of their oaths. But they continued to do that. And at this point, there were a lot of nurses that left healthcare. They took early retirement. They had said, I don't want to be a part of this. There was actually in May, June, at our hospital and hospitals in my city, in Scottsdale, there were a lot of hospitals that were offering for nurses that were pregnant to take early maternity leave. Not to mention that we had nurses that had taken travel assignments. So when, come the, quote, flu season came, there was a lot of people that weren't there. So nurses were working extended hours to support that. And I think there was, they were torn in two. They felt obligated to follow orders and keep their jobs. And there was fear. Remember, propaganda messaging limits people's ability to critically think. And whenever you tried to engage in any scientific discourse, they were always responded emotionally. Like, we're doing the best we can. There's a lot that we don't know about this. It's novel, all of those things. So you couldn't even talk reason to them. And then fast forward, all of these ones that, took the shot, they didn't want to know that there was harm. Right? Could you imagine?
Right.
Like, you have it in your body. You can't get it out. Why do you want to be the one investigating this now? So a lot of blinders.
That's exactly right. And that's why I think right now, looking back and trying to, pull back the weeds and find out exactly the timeline of this, exactly what happened in the past 4 years. It's an uphill battle always, because so many people took the shot. They're not willing to admit, okay, well, what really did we put in ourselves? I mean, we were the experiments. Who would want to admit that?
Right.
To come to grips with that. It's just,
Right.
So in the video, and I'm going to include the video, at least in the description below. But in the video, there is a doctor who was talking about the vaccine injuries that she was seeing. And you actually include a video of her in the room with a guy who's, I think you said in his 30s, having probably signs of myocarditis. And she kind of, the way that she talks about it, like bringing to his attention, and you took the vaccine. But the way that she said it was not like, you took the vaccine. We know that this is seems to be a symptom of the shot. So she didn't come out and straight say it. What would have been the ramifications for her had she come out and straight up said it?
Well, at that point, so just so people know about VAERS is for us to collect the data on safety signals. So it's not our job to determine causation, okay, but to collect the safety signals. So in this patient's example, he had taken the shot 2 weeks prior, or 3 weeks prior. He had just gotten his second dose on Tuesday, developed a cough, which on Saturday was diagnosed as myocarditis, pericarditis, and congestive heart failure. That right there is a really big red flag, right? It's a huge safety signal. They actually changed their vaccine information sheet to say that this could cause those issues in people. But that's why it's so important to report safety signals, and so that they could determine causation. So for this doctor, this example, I was shocked, Stephanie. I was shocked because this doctor was like, outwardly, she looked like she was fearful. I mean, she went against all infection control procedures by wearing the mask, touching the mask all the time, but she had gloves on. She always wore gloves. And she kept her head down at the computer, gloves on, mask on, all the time. So when I was talking to the other doctor, see, the other doctor was taking care of that patient. And he is the one who I said, "Hey, did you see the labs? All of his labs are off the chart." And he was like, "Oh, I don't know. He's not COVID positive. This doesn't make sense." And that's when she spoke up and she's like, "They're not doing studies on antibodies." And that's when I also was talking with her in the break room, and she's, said the vaccine is full of, what, and they're trying to bury it because they want to sweep it under the rug. So she was, I was shocked at her. She was a contractor, and she wound up getting terminated because she expressed that, which to this day, I don't know why she didn't fight it. She actually put in a board complaint against me and said, "I don't know why Jodi would do this. Like, she was a good nurse, why she would risk her career over this."
No, wait a minute. She put in a board complaint to you because you filmed
Recorded
it and
her.
exposed it. Oh my goodness.
Yep.
But she said it.
Yes.
She knew it,
Mm-hmm.
but she wasn't willing to stand up and expose?
No, no, and that's a problem with many. We've been institutionalized. That basically to follow policy protocol no matter what, right? And a lot of people with our education, we always thought studies had been done, placebo-controlled trials have been done. For goodness sakes, to find out that none of that ever happened, or that the study design was so short in duration, just a couple months before you push this out onto millions of people, like all of those things, for myself, I'll say I was shocked. I couldn't believe that, but our training, nurses and doctors, is basically, here's the childhood immunization schedule. This is when the doses are due and what the doses are. And if you have any adverse event, you're going to recognize it immediately. And you give Benadryl and, steroids, right? That's basically our training. Again, we all thought that studies were done, and come to find out they weren't. Not with COVID, and not with the childhood schedule.
Now, you have said before in multiple interviews that the straw that broke the camel's back and you're blowing the whistle was your friend who did not want to get the shot, a healthcare practitioner who then died.
Mm-hmm.
And so what happened there, and what was the retaliation you saw as a result of you blowing the whistle?
So I was house supervisor that night, and a couple weeks prior, I was actually taking care of, I was working in the ICU, and the pharmacist came down, in the middle of the night, because I work night shift, and said, I have 3 doses of vaccine left before I have to throw it away. It expires in a few hours. How many, who wants it? And she was like, I know there's some of you that haven't taken it yet. Now, this is in August, right? So 9 months later, obviously people were trying to get the shot. We didn't want it. We had already worked around COVID patients for 18 months, basically, at this point. And, but, there was the coercion on the unit saying, you don't want to be intubated in like room 7. Go get it. You don't want to take it home to your grandparents or your kids. And so the 3 of them went and got their shot. 2 weeks later is when she was admitted into the hospital. And she was admitted, and I was working that night, and she had said, hey, I think I want to try those meds that you've been talking about. And I printed out the FLCCC protocol, handed it to her, and then she texted me, I want to try it. And that's when I went into advocacy mode. I went and spoke with her nurse, and I said, she wants to try it. Can you look it up, see if she's not contraindicated? She looked it up, and she goes, yeah, she can try it. Let me call the hospitalist. So she called the hospitalist, and the hospitalist told her that it was controversial. So that's when I called the hospitalist and the nurse into my office, and I said, out of all due respect, doc, being controversial is not a reason to not practice medicine. A patient wants it, and would you look at this body of evidence? And she left. The nurse called me up, and she's like, she's going to order it. And I'm like, oh my God, praise God. A couple minutes later, or a little while later, she calls me up, and she said, a pharmacy's blocking it. They won't dispense it. And that's when I called the pharmacist into my office, and that's when I took my first video recording. Now, at that time, I didn't know what I was going to do with it, but I was seeing red. I was distraught. I was so upset that I calmly, talked to her. I was like, what's going on? And basically, she said that she would lose her job if she were to give it out. And I was like, oh my goodness. And when I rewatched that video and I heard her say, I don't have time to do the research. I am just following orders. That's when I knew, like, God really laid it on my heart, like, okay, now record. And now I can speak about it. All of the videos and everything that I have, which are a lot more that's never been shown yet. I guess God's waiting for the perfect time to do that. I recorded the injuries, the blood clot and the bilateral blood clots in the lungs of a 15-year-old, people coming in with neuro injuries, all of these things. And that's when I said, okay, here's my story. Here's my story. And I uploaded, the videos to Project Veritas to help me expose this.
My goodness.
Yeah.
So your friend died. She was not able to get any of the medication.
Yeah,
And
she
then
died 2 weeks later.
Oh, wow.
She was intubated. So she came in on Friday with normal vital signs. She didn't even need oxygen, but they started her on remdesivir, which at that time was, you needed to be less than 92% on room air. So I don't even know why they did that. But then the next day she needed, when I came in 12 hours later, she was on 4 liters of oxygen, and then progressed to BiPAP and then intubation within just a couple of days. And so at that point, I was like, oh my goodness, like, and we didn't even give her a chance. Stephanie, at that time, for the last 3 months, for that whole summer, everyone we intubated died. So her chances of dying, needing intubation, were at that point statistically 100%. So why they didn't give her a chance is beyond me. And after my video was released, I faced 18 board complaints. They tried to destroy me, but the ethics evaluation cleared me completely because the truth always wins.
Yes.
Um,
So there were also several lawsuits
mhm.
brought against you, one by the pharmacist,
Yes.
correct? So would you discuss a little bit of those lawsuits?
Yeah, so probably a month later, she put an order of protection on me. I tried to fight it, but they, said, no, we're going to uphold it. And I was like, whatever, I'm not talking to her. I never reached out to her. I didn't encourage anybody to reach out to her. Matter of fact, I've never even said her name. After that, I always refer to her as the pharmacist. But she received a couple of messages that said, what are you taking your orders from Fuhrer? This is Nazi-like, stuff. You're gonna get yours, like that kind of thing. No direct complaints, but the year passed by, and the judge automatically renewed it, and I was like, "Oh no,
Huh.
I'm fighting now." So I retained Ryan Heath with the Gavel Project, and we had a 2-day hearing with the judge, basically going through all of, First Amendment type speech, right? I never said she killed patients. I never said anything like that. And the judge wound up throwing that out, and I won that lawsuit. Well, then she now actively, for the last few years, has a lawsuit on me for $500,000 for painting her in a false light. And hopefully we're going to a jury trial here because I wasn't settling. I mean, I did what was ethically required of me by exposing it to the world. At that time, Stephanie, everybody was so fearful. Everybody was staying silent to keep their job, even though they knew what was happening was wrong. They just didn't feel like they could fight this corruption, that their
Right.
voice didn't matter. And I'm here to say it does. And I'm looking forward to going to a jury trial, hopefully in the next
The other
couple of months.
There's so many pieces of corruption here. I mean, you've got the corruption within the healthcare system of them hiding how bad things were, going along with what they were told, even though it was not right for
Mhm.
the patient, not doing their research, not thinking for themselves. Isn't this what they're paid for? Isn't this their job? And
Mhm.
ethically what they're bound to? And then you've got the corruption of you literally videotaped them, especially the pharmacist saying, uh, I'm being told what to do. I don't have time to do my research. I mean, that's coming from her mouth. And yet you are the one that are retaliated against for exposing the truth. So
Right.
it's just,
Yeah.
okay. So,
Yes. I mean, and there's a lot to it. There's a lot of discovery that happened in so I was put on leave, administrative leave for 2 weeks with my job as soon as the video came out. And then I was put on investigative leave for like 8 months. In total, I was on leave for 15 months, paid leave. Okay. They thought that I think they hoped that the nursing board would take my license. Little did they know that, I was ethically upholding my oath, and that's
mhm,
why my ethics evaluation cleared me of any wrongdoing. So they had to scramble. They were trying to figure
mhm,
out, like, how can we get her? How can we fire her? So basically, the federal judge has to decide, were they going to fire me prior to this? Prior to this video release. And let me tell you, there was a lot of heat that I got for speaking out. I had my boss tell me, you can't talk about anything other than what the patient is ordered, medication wise. And I go, excuse me? Yes, I can. It's my job. And the new code of ethics says that you have to give patients, they're explicit in this new code, okay, which is important. that says that you have to give patients all the information to make an informed decision. And here she is saying on video, it's on video, that we work for the government. We have to follow policy and protocols. And I, said to her, you know what? I have half a mind to go to the reservation down the street and picket. And she goes, oh, Jodi, please don't do that, And I was like, I don't know what I'm going to do, but I feel like my time here is short because they were also talking about reporting me to the board for creating vaccine hesitancy, for misinformation, disinformation. And then it was interesting because in Discovery, back in 2020, June of 2020, the chief nursing officer and the chief medical officer had an email thread about me because I was already speaking up. I was already blowing the whistle in the beginning, right? And they said, well, we looked through all her social media and she doesn't identify that she works here. But that's what I did, Stephanie. I decided at that point, I'm removing all my affiliation with them and I am going to use my voice, And so they said, well, she's not violating HIPAA. She's not associated with the hospital. There's nothing we can do. And I was like, oh my gosh. So they were already watching me for, a year, over a year at that point. And yeah, I mean, yeah. So go ahead.
Did they not seek to, well, let me ask about the exemption process because you were under the same mandate eventually, the healthcare mandate. And did you also fall under the federal employee mandate? So how did you get around the exemption process?
Well, I had a religious exemption for the flu already on file from the year before. I knew that this was probably going to start heading that way. So I was like, I'm going to get an exemption on file. And I did. I was never, I don't feel like I was ever at risk of losing my job because they needed me. They really did like my clinical skills, my assessment, my leadership. People loved working with me. Again, I was a CNA. You know what I'm saying? So I understand their roles. I'd step in, I'd help. And 99% of the people basically took it, without batting an eye. So I never felt that I was at risk. And I don't believe they were even going to mandate that until October. So, I blew the whistle in September, but it had nothing to do with, making me take the shot, Yeah.
So looking at COVID and beyond COVID, is there resistance in hospital staff from hearing the insights of family members and instead following the algorithm or the bidding of the government?
Yes, there absolutely is. I think, nurses really are torn in two. They feel obligated to follow orders to keep their jobs, but they also feel their duty to advocate for the patient. They fear risk losing their license. Many nurses knew that these protocols weren't serving patients well, but the threat of termination and board complaints kept them silent. So I, released my video September 20th, 2021. In November of that year, the National Council of the State Board of Nursing came out with a policy of how they were going to handle nurses who spoke against anything the CDC says. Okay. Completely unethical. Okay.
Yeah.
But this is what I was kind of facing going into the investigation and the board, appearing in front of the board a few months later. I was like, oh, they're going to try to make an example out of me. And what wound up happening was not. I mean, there was more ethical nurses on that board than there weren't. I think the vote was like 10-2, 10 to let me just walk away. And 2, they wanted to do like a decree of censure. But again, the moral distress that was happening, the burnout, the moral injury, and nurses leaving the bedside.
Beyond COVID, do you have examples of how you saw this kind of like institution over the person played out?
Oh, yes. I mean, absolutely. Let's talk about remdesivir, for example. That was an EUA drug that came on the scene, and none of us had ever heard of it before. And come to find out that hospitals were getting a 25% bonus payout for using it. So no wonder the suppression of filling, alternative medications like hydroxychloroquine and ivermectin were so, like they just called it out. Remember, the FDA said, "You're not a horse."
Right.
I mean, this campaign against these safe,
Mhm.
cheap, available drugs was just unbelievable. I mean,
Mhm.
so yeah, that's really, you know how they say that term, follow the money, you know?
Yes.
They were getting money on COVID patients. The 25%, if they used remdesivir, they got a 25% bonus payout on the total hospital admission. So if the hospital charges were $100,000, they got an extra 25,000. And remember, the hospitals, they lost a ton of money, from their surgeries. Surgeries are the big money makers, the diagnostic testing, the colonoscopies, those things. And so I think that was their way of recovering some money. So yeah, they use that, and then these protocols. Nurses are trained to follow protocols. We're trained to follow evidence-based practice as well. And when evidence-based practice, collides with the protocol, it's our duty to speak up and say something. We are really the last line of defense when it comes to the patient. Um, we are there solely to be the advocate for the patient. And so we must step in, when systemic, corruption starts taking over. And a lot of nurses saw that. And, again, I mean, it was also, you have a lot of nurses that were saying, about the vaccine, oh, they didn't want it. They did, they probably just wanted to die. I had my charge nurse and the ER physician at one evening say to me, "Jodi, do you think we should have to save you if you got COVID? Do you think we should have to treat you?" And I said, "Excuse me, what are you talking about?" And he said, and he goes, "Yeah, because you don't believe in the mask. You don't believe in the shot. So do you think we should use our resources to care for you?" And I was like, "Yes. Like, how are you even asking this now? We
Yeah.
take care of child murderers, for goodness sake. And you're asking me this?" Like, it was just absolutely appalling.
Could could you say your oath? Like, do you remember the words of your oath that that statement from that doctor clearly violated?
So we have, there's a lot of nursing at graduation. It's a Florence Nightingale pledge. And basically, we are to, not administer harmful medications. That's one of it. We are supposed to be there for the patient, but I don't know the actual Florence Nightingale pledge. But the code of ethics, there's 10 provisions on there, and we go through all of those. Like, our primary duty is to the patient. We have an obligation to continue to research. We have an obligation to continue to speak out. We also have an obligation to ourselves, Stephanie, to protect our integrity and our moral injury, you know? And and to speak out when we feel like, institutionalization is occurring. And I think for a lot of nurses, they realize how systemic it is, starting in nursing school, the way we're trained, all the way leading up to, taking care of a patient.
Yeah. What do you think is the root cause of the corruption that you saw, continue to see, that needs to be changed so that this doesn't continue happening within the healthcare system?
Well, I think nurses need to understand the code. Again, this is also something that is brushed over. I don't know, you may get an hour of education on it in nursing school, right? They don't really hammer it down. It should be a semester long, or actually, it should go throughout your entire nursing program, where you're talking about case studies, you're talking about recognizing ethical dilemmas in real time, how to handle that, how do you, how, do you call for an ethics committee? Do you talk to your charge nurse? All of those things. But a fear, I mean, goodness gracious, it's fear. Fear is at the root of all of this. This is how they got people to be afraid.
Mm.
I think for me, it was my faith. I had submitted to the will of God in June of 2020. And when I realized what was going to happen, I really had a discernment. I worked in detox and recovery as well. And my heart just went out for all of these people in their AA, NA meetings,
Mhm.
uh, and I was like, what's happening to these people? We are literally creating a society that is going to be so stressed out and fearful. And that's the root of it. That's the root of it. People putting their material possessions above what they're, being called to do. I can't
Mhm.
tell you how many nurses and physicians, for that matter, that have reached out to me and said, I knew this was wrong. I tried to do this. I tried to do this, secretly, but now the time really has come to expose this, use our voice. People ask me all the time, how are you able to be on air talking, about all this stuff? And I said, ethics. Ethics, it's our duty to do that. It's absolutely within our scope of practice and duty to not only continue to research, we take an oath to do that. Like, our training doesn't end when we graduate. We're supposed to continue to do that, but really, fear is driving all of this. And I think with all the, Charlie Kirk's death, it's really reignited people to realize, first of all, who their friends are, what their friends believe. During COVID, we were taught, oh, just stay quiet. Don't worry about your neighbor. Just handle you. Just worry about you and your family. And really, my faith says that I'm supposed to love my neighbor as myself. And that's why I spoke out. That's why I recorded what was happening, because I knew that people were propagandized, that the only way I could get through to them was to show them what people actually thought and felt in real time. And now, I am seeing, I have had so many people reach out to me. It's just so inspiring that they're like, no, I'm speaking out on the nurse station. I'm talking, I'm making my position known. Because I've always said there's more of us than them, but we're silent. We cannot be silent any longer. We have to speak from a
Yes.
place of love and engage in scientific discourse and debate. They don't want us to do that, but the enemy will not win. We have got to first look at yourself, look at your life, right? Are you living above your means? For me, I knew that I wasn't. I mean, I'm still in the same 1,000 square foot apartment 4 years, 5 years later. You know what I mean? Because I don't know what's going to come of this. And I want to be able to still pay my bills if I need to go waitress again. You see what I'm saying? And so I
Yes.
think people need to put um, less attention on their material possessions. And really, I tell people our time here is short, guys. We never know when we're going to leave this earth. And when you stand before God and, you have to account for your actions, are you really going to say, I was afraid to lose my job? Which you're going to say, I didn't trust you, Father, to protect me? To see me through. I mean, no matter what happens with me, Stephanie, no matter what happens with my case, all of, these 2 lawsuits, no matter what, I know in my heart that I did what I was called to do. And however God wants to use me is how he's going to use me. But I've also seen a lot of people, a lot of warriors he's brought around me to handle everything that I've done. Has it been
Yes.
hard? 100% it's been hard. I've learned things that I've never wanted to learn. I didn't want to learn website and social media. You know what I'm saying? But now I have those skills. So, I just want to encourage people to realize that our duty isn't to institutions. It's to our patients and people. The new code of ethics describes them as the recipients of nursing care. So right now, I'm identifying as a nurse and I'm speaking on your platform, and this is going to go out into the world. I have to uphold my ethical duty as a nurse to everyone that listens to your program, right? To listens to this podcast. And that's what I want to encourage in people, to bring integrity back into healthcare and their faith.
Yeah. You have created an ethics course, which you are now providing on your website. Would you like to discuss that a little bit?
Yes. Let me tell you, I spoke about all these things that I'm doing. But in January of this year, I got a word from a friend. She's like, I'm thinking righteous RN. And I was like, oh, okay. So I started looking into like, what does that actually mean? And I, realized, it's like to bring integrity, grit, and faith to drive ethical care. And so what I did was all of these board complaints, all of my investigation through the whistleblowing, all of these courageous nurses that spoke out, right? I took their stories and mine and I made case studies. So it's not your typical hospital mandated ethics course that really just talks about what do you do if your patient doesn't want blood products. Okay, that's really the case study that they use. I take every single complaint and experience from nurses, and I made a 10 CEU ethics course that nurses can hopefully get reimbursed. Once they complete it, they can, a lot of hospitals offer outside education. So could you imagine, like, if they come in and they're like, oh yeah, and you're going to pay me to learn what I was supposed to have learned, 10 years ago or whatever. So yes, so that is my baby. And I also have a community attached to that, to where we can discuss ethical dilemmas, case studies monthly. And yeah, I'm hoping to get this course up at the national level from NIH and create certifications that nurses actually have to be certified in ethics. So that's my ultimate goal, is to bring this
Yes.
to the nation.
Certification in ethics. Boy, would that change healthcare.
Yes,
Wow.
yes, big
Well,
time.
where can people find you?
So, I mean, you can find me at Nurses Out Loud. Nurses Out Loud was a radio show that we created. Actually, Dr. McCullough asked me to be on his platform, and I was for a few months. But then some nurses asked me to do a podcast with them. And I brought it to the owner, the network owner at AmericaOutloud.news, and he said, why don't you create a show? I'll give you 5 days a week, 10 a.m. Eastern Standard Time. It's on iHeartRadio. All of our shows go to podcasts. Starting this year, we started repurposing it and doing videos. So now they're on Rumble as well. So you can find out what I'm doing and what all these other awesome nurses are doing. We have Functional Nurse Academy, which is a training in root cause approach. That's 90 CEUs, and that's under $3,000 for a certification on that. We also have Nurse Freedom Network that will put the nurses to work, where patients can actually have a nurse help guide them in their care. Also another nurse, Ashley Grogg, just came out with the book Resuscitating Nursing. So we have created a system in and of ourselves. So I tell everybody to go to nursesoutloud.com. But also, too, if you do go to righteousrn.com, you can download my book, Rare Courage, Standing for Right When You're Surrounded by Wrong, for free. When this happened with Charlie, I realized he was the first person to interview me, Stephanie. He was courageous back in 2021 to interview me when other people who I was set up to interview with the next day said no, they weren't going to interview me. Any of the major platforms? Nope. But Charlie did. And in honor of his memory, because Charlie and I both believe the same, that number one, we're here to follow God's will and see what he wants, how he wants to use us, and to encourage courage. And if you go to righteousrn.com, you can download my book right now. You can get the PDF file of it and read it. And I just hope that inspires courage in people.
That's awesome. Jodi, you're doing so much. Great work.
Thank you.
Well,
I feel it.
Let me pose to you the last question that I like to ask my guests. If the average American citizen could do one thing to combat the corruption that we see in our country, what would it be?
Refuse to be silent. Refuse to be silent. Corruption thrives in the dark, whether it's in healthcare, government, education. Silence is what allows it to spread. And the most effective way to combat corruption is to speak up when you see wrongdoing, even in small ways. That could be asking questions at the bedside, at a school board meeting, or even at your workplace. If you use your voice, file reports, report people that are being unethical, document what you see, share the truth with others. If the average American can do one thing to combat corruption, it's refuse to be silent, really. And when ordinary people speak up, ask questions, document the truth, the system has no choice but to change. And the way you do that, in my humble opinion, is to not allow fear to have any place in your heart or your mind. I always like to tell people the enemy is the author of confusion. How I knew that this was God's calling on my life, to expose it in the manner in which I did, virally to the world, was because he laid it on my heart to do that. And then I was met with anxiety, fear, uncertainty, right? I didn't, they're going to kill you. They're going to kill your family. These are the voices and the thoughts that were in my head. And I knew at that point that that was the enemy, because God does not lay something on our heart and then cause us to question it.
Those are excellent words, Jodi. It's just, it's an honor to speak with you. Just been so clear and bold, and I am so thankful for your voice and for your continued belief in the Lord and continuing to speak Him in the midst of this. I mean,
Yeah.
that is extraordinarily admirable, and I'm really proud to know you, Jodi.
Same with
So,
you, Stephanie. It's been hard. I tell people there's a lot of peaks and valleys. Even these nurses that are coming out, speaking out against, what happened with Charlie Kirk, or celebrating it. It's I want to help people, and through my experience, that is exactly what I intend to do. I had a nurse basically whistleblow and didn't know what to do. We had PR attorneys that were charging her $600 an hour and didn't even help her. Yeah, I want to give people the words. I'll
mhm.
leave you with this. I tell people all the time, the Bible, the Word of God, is what guides the believer, right? How do we even know who He is if we don't know His Word? So as a nurse, this is true. The code of ethics guides you. How do you know what to do if you don't know the code? So the two of them go hand in hand, in my opinion, and that's what people will get from me. I don't push my faith onto people, but I definitely speak it. Don't be afraid to speak it, because that is why we see the light shining now, is because of people speaking, their faith out there instead of being ashamed or hiding it. And that is what is going to make change in this world in a positive direction.
Absolutely. Jodi, on behalf of Feds for Freedom, thank you so much for coming on today. It was just an absolute honor.
Thank you. Same here.
Thanks so much for tuning in. Please like, comment, subscribe to, and share our podcasts. I'll see you next week.